All right, so we're recording now. Goat Montana is brought to you by USDA NIFA and free to put them in the chat, and we'll kind of go through them as Dr. Rosie gives her presentation. And I'm going to unshare my video so you don't have to look at my mug during the presentation. So I'm going to turn over to Dr. Rosie.
All right. Okay, well, thank you guys for joining us. There's so much that we could talk about with goat health, so I do have a lot of slides, so we'll just get rolling. But, you know, there's no way that we can possibly cover everything. So hopefully there is some time at the end for some question and answers. If not, my contact information is at the end as well. So I'm the sheep and goat extension veterinarian at UC Davis. So I have a statewide appointment, but I also do a lot of these educational talks across the country. So thank you guys for having me today. Let's see if I can get this to work. There we go. Okay, so we know that there's a ton of diversity within the goat industry, and that impacts our decision-making from a disease risk standpoint. What do we do to prevent disease and control disease once we have it? So we'll kind of talk about what some of those options are with these different types of goat operations. So first and foremost, it's really important to understand what your goals and what your expected outcomes are for your operation. Meaning, you know, what kind of income, what kind of assets do you have? What market are you hoping to go into? Is there a time frame that's specific to that market? And then how do you measure success? If we're raising replacement kids, is that your main income? So all those things really go into kind of disease control and just herd health in general. You know, some really specific differences would be like if we are on an annual breeding cycle versus these accelerated cycles, or the complete opposite, extended lactations with dairy goats. So there's so much diversity, and really important to hone in on what is important for your type of operation. For some operations, it's important to, or for all operations really, it's important to look at the big picture. And with that, we can sort of backtrack and plan what our year might look like. So for an annual breeding operation, it's going to look more, everything should look pretty circular. So you just saw an accelerated lambing system that is still within a circular annual calendar. There's just a lot more going on there. This is an annual breeding operation that has their events timed based on when feed is most available. So they actually plan their lambing time. This is for a sheep operation that we drew their calendar for them. And they plan their lambing so that they have the best forage available at late pregnancy and then into lactation. So things like that. When is feed most available? Or, you know, if the market is dictating that, how can we best supplement them so that they have the best nutrition at their greatest times of need? And then planning events that need to happen for the rest of the calendar. So we call those, anytime we gather animals in extensive operations, we call those windows of opportunity. So how can we make the most of those opportunities and, you know, make some, whether it's disease control decisions or measure performance. So when can we do those things? Are we measuring reproductive performance by scanning them? Are we able to keep track of our lambing and kid birth rates as well as weaning rates, and then measure how good our ability is to raise lambs and kids through that period from birth to weaning. So it's good to have a plan for that so that you know strategically when you're going to do those, and then you are ready to capture that information. Some of the basics that we'll have would be like vaccinations, and there were some questions about specific vaccinations and options for your herd. There's maybe one core vaccine that everyone should be using, and that's the CD&T vaccine. And we'll talk about timing for that. And everything else is pretty much risk-based because every time you vaccinate an animal, certainly there's a cost to their production because their immune system responds, right? And there's a financial cost of buying vaccine and the labor to give it. So we don't just vaccinate for everything because one, it can interfere with how we test for disease, but there's a cost to that. So we'll talk a little bit more about vaccinations as we go. And then hoof care. So goats need hoof care at least 2 to 3 times a year. They're different from sheep in that their hooves are just a lot harder. They're built for climbing cliffs, right? So their hooves do need to be trimmed relatively often. Otherwise, we do see some conformational deformities that make it difficult for them to get around. Body condition score, we'll talk about that a lot. So body condition score can be a good measure of how well our nutrition program is working, but also can be an indicator of disease. So it's not a specific sign, but it is a general sign that either nutrition isn't on point or we have something else going on. And then parasite control, and we'll talk a lot more about that. And then, of course, shearing if we have fiber animals, or clipping or primming if we have goats or animals that, maybe need to be cleaned up around kidding time so that their kids are able to get to the udder in a clean environment. Okay, so body condition scores. This is from a scale from 1 to 5. Some use half increments in between because we like to have more options. Most healthy goats are right around 2.5 to 4. We don't really want, a fat goat is not necessarily a healthy goat. We don't want 5s because that can cause a lot of problems with dystocias around kidding time. It can cause problems if you can imagine, goats carry a lot of their fat inside their abdomen. So if they have a lot of fat outside, there's that much space, if not more, taken up inside. And at the end of pregnancy, when they have already so much baby growth inside their abdomen taking up space, they need as much space as they can get to ferment all the feed that they're eating, right? They need that room and space, and that's already so limited. If we are taking up space in the abdomen because of abdominal fat, then they're at a much greater risk of pregnancy toxemia. So we do want to keep goats in that kind of medium body condition range, especially by late pregnancy. Now, that said, if we have heavier goats, we don't want to put them on a weight loss plan while they're pregnant because, again, that kind of starvation mode is what causes ketosis. So we want them to be able to eat as much as they can to be able to maintain their pregnancy. The American Dairy Goat Association and Langston University have published a really great video and some resources on learning how to do body condition scores on goats. It is quite a bit different than doing body condition on sheep or cattle if you've done those. They are looking over 3 different regions. And the main thing I think that's really important is that within an operation, it should be the same person that does it every time, because we're going to maybe disagree by half an increment or not, So if it's the same person who does it every time, then at least that consistency is there. So if you're looking at body condition at weaning versus pre-breeding, if it's the same person, then that trend is more meaningful than if it's 2 different people doing that score. Okay, so for breeding animals, again, we'll talk a bit about vaccinations for them, breeding soundness exams and what that means, pregnancy diagnoses, and then again, they may have more specific shearing or primming, and then ensuring that females that have just raised a kid or were in milk production get a sufficient dry period before their next freshening or kidding. So for dairy does, that's usually about 45 days we would like that to be. And understanding that some especially really good milking does, have a really hard time drying off. So that can be really challenging, actually getting them to dry off for enough time for that udder to kind of reorganize all those tissues, get good blood supply back, and get prepared for that next kidding event. And then really good to have a management plan or protocols in place for kidding, because we know that's a pretty intense period of time and we want to be prepared for things that can happen there. All right, so our pre-breeding management for does is going to include a body condition score. So this chart down here is from OMAFRA in Canada. So it's basically showing on that left side, the body condition score, again, from 1 to 5. And then across the bottom is her kind of stage of production. And you can see how body condition score, we kind of expect it to fluctuate depending on where she is in that stage of production. That's true for dairy does as well as grazing or meat production does. So doing body condition score, like you can see here in late lactation, right around weaning, it's going to be probably the lowest it will be. And that's to be expected because she's using a lot of energy to make milk. And now she's growing a baby if she's a dairy doe. If she's not growing a baby because she was a dairy doe, she's probably raising twins or triplets. So it takes a lot of energy to make milk. So at that time point, I do expect her to be at her lowest body condition score. But you'll see over here where it says dry to breeding, we expect her to be able to recover. So that's why doing body condition score at pre-breeding helps us to know if she's in good condition to be bred, maintain that pregnancy, and then be, again, prepared to raise those kids in that next cycle. Does that are thinner, so that don't recover from weaning to or dry off to breeding, they're more likely to have some of these diseases that we'll talk about, and they're more likely to actually transmit those diseases to their kids. Udder palpation is a good thing to do at this time as well, because, especially for meat production does or grazing does, they will have been dried off for, a couple of months. So this is a great time. If you are feeling anything abnormal in that udder, there should be no milk in there at that point. So this is a good indicator that you can tag her or you can not breed her, whatever the options are, but make sure, this is the time that you'll know, okay, I need to watch this doe when she has her kids because she may not be able to produce enough milk for them. At this time, if we have any abortion agents that have been diagnosed from previous kidding seasons, pre-breeding is the time to give those vaccines. All right, so health checks for bucks. Again, body condition score. We know that they do tend to lose some weight during breeding season, and that's mostly because they're just working really hard. They don't really think about eating. They just have their job to do, and they do it very well. So they do tend to lose condition. So we want to make sure that they're in really good condition at least a couple months before breeding season, because it does take around 60 days for them to produce that sperm. So if we've got them in good condition, they're getting the right minerals and nutrition that they need, their chances of producing good quality sperm are a little bit higher. We want to make sure that they have sound feet and legs. Also a good idea to do routine health testing for our chronic diseases like caprine arthritis encephalitis virus. CL is another one. Johne's disease might be another one. And then fecal testing for parasites. So especially if we're bringing bucks on just to breed a few does and then that buck moves on to another premises, we want to know if that buck fits within what our comfort level is for disease risk. So those are some things to consider that we could do. Otherwise, breeding soundness exams traditionally with bucks is a good physical exam, measuring scrotal circumference, because that has a lot to do with their fertility. And then you can have a veterinarian or technician come and work with you to electroejaculate the bucks and measure sperm motility and morphology. It's pretty critical to have those to have good confidence that this buck can actually breed a doe. All right, nutrition is pretty much the basis for herd health. So we want to make sure that they have not only enough protein, but energy in their diet. So if we are, especially in certain systems, this is a little bit challenging. We have to supplement, and it's hard to supplement sometimes, especially with rainy weather. Goats tend to eat a lot less when it's wet outside. So really trying to manage that diet. And let's say if we have great nutrition, they're eating really well, our buffer from having clinical disease is a little bit bigger. If our nutrition isn't as great, not because it's not available, maybe it's not available, but maybe they're just not eating as much because of the weather events we're having, our buffer for clinical disease gets a lot smaller. So your wiggle room that you have gets really narrow. So that's why trying to manage that nutrition, especially between storms. So here we have a lot of weather events where we get a couple of breaks in between. And that's when we have producers going out, putting dry hay, putting fresh feed in front of them. So they'll eat between these weather events and be prepared again during another rainstorm or what have you. In our area, copper and selenium tend to be deficient. Minerals are very much a regional challenge. So, for example, in Colorado, they tend to be selenium, they have an excess of selenium. So they might actually see selenium toxicity. So my recommendation for you is to talk to your extension and find out what your mineral tends to be like in your area and the best mineral supplementation for you. Feed bunk management becomes really important. We want to make sure we have enough linear space per animal in a pen. The general recommendation is between 12 and 16 inches per animal if they're being limit fed. So that means like they're only being fed twice a day. So they all tend to go at once. If they have access to feed all day long, then that linear space gets a little bit narrow. So it might be about 8 inches per head. All right. And then, so if we are running sheep and goats together, recognizing that sheep are far more sensitive to copper than goats are. So making sure that we're not putting a goat supplement out that sheep have access to. And we could see things like copper toxicity. And then water is super important. We do see water intake fluctuate quite a bit depending on the season, depending on how hot it is, and also depending on how much either snow is on the ground or how lush the forage is that they have access to. In the summer on dry feed, we may see goats consuming or taking in about 1.5 to 2 gallons per head per day. And if you have lactating goats, then that could be much higher. All right, so late gestation, again, good to get a good idea of body condition. And then this would be the time where we would be doing or I like to recommend doing our CD&T vaccine. So we do this because then we have antibodies present in the colostrum. And so if we do any processing of our kids, like castrations and things close to when they were born, then it's good to have that on board. These are yearly vaccines, so we want to vaccinate our does every year for these. The J5 is a vaccine that I would only do if I was having a big problem with scours in that first week of life of my kids, or was having a lot of problems with gram-negative mastitis. But again, only something that I would do in those cases. It's not labeled for goats, so we would need to work with a veterinarian to kind of gain access to those vaccines and have a protocol for those. And this graph is just showing that birth weight of lambs and kids is really important for their survival. So we don't want these really light lambs and kids, and we also don't want really heavy lambs and kids. The weight of lambs and kids is very much dictated by their genetics. So unlike horses and other animals where their placentation makes it so that they only grow to as big as their environment, their uterine environment, so where they are developing allows them to, goats, they can grow to whatever size their genetics kind of dictates. So the thought of underfeeding goats to try to limit how big the kids will be is not a great idea, just because again we can make them prone to pregnancy toxemia, and it doesn't really impact the size of the kids that are born. Okay, so kidding in cold environments tends to involve a barn. In a lot of our environments in where I am on the West Coast, we may or may not have access to a barn. So we tend to use things like the topography of the landscape to help protect them from northern winds. We might use tree or brush cover to help provide some insulation. But really making sure that kids get up quickly and our nursing is the best shelter. So I know of folks that during a storm will go out in the middle of the night to get everyone to stand so that the kids can get under and get a good meal in the middle of the night when it's the coldest. This little chart on the top right there is showing that red line is their metabolic rate. And that's kind of, what makes, it helps keep our core body temperature up. So you can see as temperature goes down, goes more towards the left, that metabolic demand increases incredibly. So as the temperature goes colder, both young kids and adult does require a lot more energy. So this is where, when we can see some challenges with adult does in colder weather, we can see more disease and things like that. And a lot of it is related to our inability to get enough nutrition into them so that they can maintain their body temperature. One of the good things about them being a ruminant is that active fermentation in their rumen is actually produces heat. So just, having constant food supply to them can really help protect them in colder weather. Whether or not they'll eat is one of the challenges. If we do decide to kid inside a shed or a barn, it is really important to make sure that the bedding is clean within the first 24 hours that those kids hit the ground. That really greatly reduces mortality related to infectious diseases when the barn environment is cleaned. That's probably a little easier to control if we have individual pens that we put new moms and babies in. If we have just a big open pen where all the does are, we have pregnant does mixed in with kidding, does that have already had their kids, that can be a little bit challenging to make sure that environment is clean. So one strategy with that is having one side of the barn that's designated for pregnant does and the other side for does with their babies, and making sure that that side gets cleaned more often, if necessary, if we don't have labor to do both, more often than the side that just has pregnant does. All right. So again, because kidding season tends to be quite busy, it's really helpful to have a plan in place that can help us kind of make decisions in the heat of the moment. If you're very seasoned, then this can be really easy because you have a lot of experience and you kind of know what has worked in the past. But if we're teaching our family or if we're going away for a weekend, during kidding season, which happens. I know it's not ideal, but it happens. Having things like this that help people make decisions on your operation can be really helpful. So this is a chart that I designed for our sheep extension center here in California. And it helps just make sure that everyone's kind of on the same page. What do we do if we see something? And then it kind of leads us down to, choose your own adventure kind of thing, down to what the protocol would be. And then they go to that protocol and they follow those directions. And if they have questions, then they call the herd veterinarian or the manager in charge. So this can help really ease that stress when you have a sick animal or something going on. It can also help identify what supplies and medications are needed so that you're not scrambling last minute to have something in a case where you need it like yesterday. We know how terrible shipping and supply chain has been in the last couple of years, so it's good to have those prepared. Kidding management, this looks very different depending on the type of operation that you have. So if, for example, we have dairy kids that are being reared, we can call it artificially, so they're not being dam raised, they're being bottle raised, then we need to make sure that they get colostrum. In herds that have have a history of having CAE or mycoplasma, or a number of these other diseases that we'll talk about, heat treating colostrum is a great way to make sure that they get the antibodies, but they don't necessarily get all the diseases that come with it. There are colostrum replacers out there. The challenge with those is they're not as good as having colostrum from animals on your farm. If we have dam raised animals, it does make disease control for those diseases a little bit more challenging, but not impossible. So those are two differences with kid management, is how we make sure that they get colostrum. With a dam raised baby, we want to make sure it's up and nursing within an hour. The longer it is lying down in a cold environment, they have such high surface to body volume ratio, they just lose heat so quickly. And while they're born with fat, that as they burn that fat, it actually produces energy. It's that brown fat. If they're cold, they've run through that really fast. So it just makes it even more important for them to get up and nurse as soon as possible. We also know that they need that colostrum before 6 hours. So we used to say, you have 24 hours to give colostrum. Well, now we know that while that is true to an extent, gut closure starts as soon as they start picking up any kind of, whether it's, dirt, bedding, they start rooting around, anything that enters their stomach starts that process of closing the gut, so they can't take antibodies in, which is where they get their initial immune system from. Also, the enzymes in their stomach start producing, and so then it actually starts kind of digesting those antibodies. So we really do want to get colostrum in within those first 6 hours after birth. Vaccinations is something depending on when we vaccinated the doe. So if we vaccinated the doe for CD&T in the last month before she kidded, then we're not going to vaccinate that kid until it's at least 2 months old. So there's those antibodies that they get from colostrum, they will actually make that vaccine not work so great for that kid. If we have a question about if the mom was vaccinated or if the kid received enough colostrum, then I would absolutely vaccinate that kid for CD&T. All right, and then this is when we would also do different procedures after birth. Okay, so again, reproductive management becomes pretty critical for kind of managing herd health. We want to make sure, honestly, for a great annual herd health program, it's really helpful to have breeding windows, kidding windows, so that you're concentrating those events into periods where you are prepared and you can manage them. If we have bucklings that are in with their other doelings that are in there or with other adult does, if they haven't been castrated by 4 months of age, we wouldn't consider them sexually mature, so we wouldn't choose them to go breed the next, year's kid crop, they can absolutely get animals bred. So making sure that we have them castrated before they're 4 to 6 months of age if we do not want to keep them as a buck. If we want to keep them as a buck, making sure that they're removed from females before that time is really important. And then when it comes to when should we think about breeding our doelings, usually we want to base that on body condition and mature weight. So, depending on the operations, a lot of folks will try to have them, wait until they have their first kid until they're 2 years old. So they're bred right around a year and a half, a little bit later. And that's because, depending on what their nutrition is as they're developing, maybe they're not making mature weight until they're a little bit over a year old, or 85% of mature weight. And that's, we want to make sure that when they're pregnant, they're able to take in enough nutrition to support their continued development and the growth of the fetus. And then bucks typically are most productive between 1 and 4 years of age. Okay, so how do we know when we have trouble? So honestly, just looking at our goats is the best way to pick out anything that stands out. We can have acute disease that, we can very clearly tell something's wrong. They're coughing, they're not eating, maybe their udder looks really abnormal. Their, abdomen's really distended, they have diarrhea. These are all signs of disease. Subclinical infections may not be as noticeable. So we might find that their growth rate as, after weaning is not as good as it has been in years past, or milk production in dairy does is not as good as we expect her to be. So that's where having those kinds of records can help us kind of learn what we typically see with our production system and, what we would like to meet or exceed. And it can kind of highlight when we're having problems. We do have diseases that tend to be endemic. So those are like the diseases I talked about with CAE, CL, Johne's disease, all the clostridial diseases. They're here. We are, need to try to prevent or manage them. Some of them are very production limiting. So really important that we pay attention to them and kind of know if we have them in and around our animals. Disease outbreaks can happen, if we have diseases that we've never seen before. They could be potentially diseases that are endemic to the US, like CL or chlamydia for abortions. But something changed to where now we're seeing it on our operation. So change of management, change of environment, if we're bringing in new animals, things like that. If our vaccine didn't work for whatever reason. So we kind of talked about this a little bit. You can have clinical disease, which is that acute disease, and then versus subclinical. And a lot of times what we see is just the tip of the iceberg. So it should key us in to, there's likely a little bit more going on to this, and we kind of need to know what the full picture is to best know how to manage it. Subclinical disease, like I said, can be a little bit difficult to measure and can kind of require us to take a little bit, either do diagnostics or have some data to kind of understand how it's impacting our animals. I like this quote, we miss more by not looking than by not knowing. And I think that's a really important takeaway, is that the more chances you have to just be with your animals, watch them eat. I have a friend who, asked if I could have an automated feeder feed animals in the lambing shed. if I would do that. And it, my gut reaction is like, no, because that's when you can see if they get up, if the lambs get up and nurse, and if they go to eat. So it's like those normal behaviors that you expect to see every day. As soon as someone doesn't do that, it should raise a red flag. And you don't have to know what's going on, but just noticing when those abnormalities happen. Okay, and so one thing I would say the most non-specific sign that we have is, reducing feed intake, so no appetite, and then weight loss. So we can see that because, one, disease can make them feel like they just don't want to eat. They don't have the energy to eat. So they reduce their feed intake. We can have diseases that actually interfere with how nutrients get absorbed into their body. Usually disease and fighting disease costs energy. So we have a decrease in body reserves, increase in loss because of diarrhea or things like that, and increased cost of maintenance. And so that's where we tend to see weight loss. I know, at least with my experience, a lot of folks think, oh my gosh, they're losing weight, we have parasites. And so then we immediately treat with a dewormer. And don't get me wrong, deworming something that's thin could probably benefit from a dewormer just in case it has parasites, but keeping an open mind to, if it doesn't respond to that, there's probably something else going on. So we have a lot of other reasons why they could be losing weight, especially if it's an isolated animal that's losing weight and the rest seem to be maintaining. Okay, so how can our herd veterinarian help and be involved? So I know veterinarians are a little bit challenging to gain access to because we have definitely a veterinary shortage situation, even in California. But this is where we can, if we can have a really targeted approach, then maybe we can engage even our small animal or horse veterinarians into helping us with our sheep and goat operations. So when we have our veterinarian out, we want to look at the whole operation. So, identify what some risk factors are, and maybe we'll even do this before we have a problem and develop that relationship with a vet. And so we can talk about what our operation goals are, identify the risk factors, look at the healthy animals, and if we have any animals we're concerned about, look at them last. And that's where we can do an exam, talk about what we think most likely challenges might be, and maybe do some targeted diagnostics. So that's where things like learning how to do a field necropsy, if your vet is really busy because there is a vet shortage, if they can't get out there and, and if you can't bring your animal into a lab for a necropsy, learning how to do a field necropsy can be really helpful. And knowing what samples to submit for diagnoses, and all of these can be conversations with your vet and can really help target our treatment decisions as we go forward. Principles for disease control. So again, knowing what we're working with, maybe it's the disease that's actually making them sick, or maybe it's just knowing what is in our herd. So do we have any of these chronic production limiting diseases that don't make them outwardly sick, but can definitely impact their productivity? We want to try to minimize the infection pressure with some management changes. Maybe improve host response, and that might include with vaccines. We can prevent new infections with certain practices. And then certainly we can talk about ways to select animals who are resilient to or resistant to disease to improve our herd outcomes. It's really helpful, again, why we want to know what is causing disease, because we can target an approach based on how they get it. So all these diseases have different ways that they'll infect one another. So it's not just about what disease it is. It depends on what environment we have. So how, what is the infectious load in that environment? Is it, is there a way that we can decrease that? and then our host. So how susceptible that host is. So we know that really young animals are more susceptible to disease than adult animals are. So managing how we're housing animals and all that can really help us really minimize disease or control disease even when it's in our population. So with biosecurity, you might think of moon boots and lab coats and things like that. But really when we talk about biosecurity, we are kind of just talking about, whether that means screening and quarantining new additions, maybe having isolation pens so that if we have animals that do have, a CL abscess that looks like it's about to rupture, we can isolate them, control that, and then put them back with the herd when we've got that under control. As far as traffic control, again, when we know certain populations are more susceptible to disease, we go from naive to disease. So we'll want to go from the young animal to the adult animal anytime we're doing any kind of herd work, or potentially working with our flock of origin first and then working with our new additions if possible. When we talk about hygiene, it's important to know which disinfectant is going to work for this specific scenario, but the most important thing with hygiene and disinfection is the cleaning process. So we want to make sure that we actually physically clean the space, and then the disinfectants are most likely to work. There are disinfectants that don't work really well on organic material, like bleach, for example. So if we're bleaching surfaces that have a lot of manure and dirt, it's really not working. So again, cleaning and then picking the right disinfectant for the type of disease that we have. And then remembering that there are some diseases that we can get from our animals. So just, being extra aware and, hand washing and, having barn specific clothing, potentially gloves if we're doing dystocias and things to try to minimize that risk of diseases going from the goat to us. Okay, so some specific diseases that we'll talk about. Caprine arthritis encephalitis virus is a virus that is, once they have it for life. It can affect any age, but typically we're seeing goat kids getting it from their dams. So the signs are, we actually don't see the neurologic signs in goat kids as often anymore because it was such an obvious form of disease. It was pretty easy to select against those animals. So that strain of the virus or variant is not as prevalent in the US anymore. But that would be one reason if you had a kid that started looking neurologic right around, a couple weeks old, you might think CAE. It does cause those really knobby knees, so arthritis, synovitis. It also causes hard bag. So this picture on the right it looks like a big, beautiful udder there, but it's actually really firm, and that is an udder that cannot produce any milk. So if we're just visually looking at udders before kidding, it's really hard to tell which ones are infected with this virus and not going to produce milk versus udders that look like they should be able to feed triplets. And then another thing is it could explain some weight loss that we would see in our animals. Like I said, most in goats, this virus is mostly transmitted through colostrum and milk. But about 10% of animals can have transmission through respiratory, the transmission route. So it can spread from an adult to an adult. It's just less likely. So like I said, once they're infected for life. And this disease impacts how long they can stay in lactation, how much milk they're able to produce. It's also been shown to change how much milk, fat, and protein and lactose they have. So animals infected with these viruses they have less cheese yield from their milk. And then lameness, which can impact how much, how often they're up to eat, and which can also impact their milk yield. So kind of already went over those. The diagnostic testing is a blood test. So it's the red top tubes where we get serum, and that's an ELISA where we're testing for antibodies. So it's a broad test. It can detect multiple different strains of CAE. The only challenge is if you have a kid that has just nursed from a positive doe and we measure them, we're probably detecting maternal antibodies. It doesn't mean necessarily that they'll be infected. Very likely, because it was nursing from a positive doe, it will be infected. But there are, the 10% of kids that actually don't get infected from their dam. So, if we are testing kids, it's recommended to wait to test them until they're 6 months old. And then, all right, yeah, waiting for clinical signs is probably a bit late if we're trying to control this disease. So often with disease control, it's not a one and done. So the virus, it takes a little bit of time to actually show up positive on the test. So when they are exposed to actually testing positive, it takes like 3 months. And so at the point of testing, if we test everyone, there's a chance that some that test negative will still be positive. So it is important, especially if we've decided to start on this disease control path. Some herds are testing every 6 months to try to really identify the animals that are positive and negative and deal with them however they've chosen to. Depending on the goals of the operation, we can split them if we have the ability to put them in different facilities. As long as they're 6 feet apart, they shouldn't be able to cross contaminate. So we can, test and just cull the positives if there's not that many. But if we have quite a few positive animals, then that's where we might just isolate the groups. And then if we have kids that can be raised artificially, that's where snatch rearing can be really helpful. Snatch rearing, though, would mean that we'd have to be really on it when we're in kidding season, because we don't want that kid nursing from the dam at all. So some people will tape teats. Some people have video monitors in so that they can watch every move and make sure that they're present whenever a doe is kidding. And then they'll provide heat-treated colostrum for their kids. All right, and then additional benefits if we are snatch rearing is that it also helps control mycoplasma disease. Johne's disease potentially can really reduce the exposure that these kids have to CL from the adult animals, and then the parasites that adults will be shedding around the time of pregnant or birth. So some of the challenges, again, with snatch rearing is that it's really helpful to know breeding dates so we can anticipate when kidding is going to happen. Ultrasounds can help with that. If we don't have breeding dates, we can age fetuses usually. If we're able to ultrasound them between 35 and 65 days, we can do pretty accurate aging. And then these other methods I mentioned. Colostrum management is really important. So depending on the heat treat method, it has to be maintained at the temperature for an hour. I think it's, I can't remember. I think it's 65 degrees. I have it in another spot, but it's much higher than 65 degrees. But so anyway, the challenges is actually maintaining it at that temperature for the entire hour. So if we're, heard of people doing different methods where, we're including the time to get up to temperature, we want to make sure that we actually maintain that temperature for the whole time. All right, CL can infect animals at any age. Usually we start seeing signs of it at around 2 years, but we can see it younger. It's a bacterial disease and it causes internal and external abscesses. The internal abscesses are usually in their liver, kidneys, and lungs. And they, I've heard of herds that have actually been able to eradicate this disease from their operation. Part of that is with identifying animals with external abscesses, like I said, isolating them, lancing the abscess, cleaning the wound, and then waiting for that to close before putting them back with the rest of the herd. And so that sort of environmental management really helps. Another way is introducing the CL vaccine. So that vaccine is a pretty rough vaccine. So if we are including the vaccine, it's meant to help reduce the number of external abscesses we have, so the amount of shedding of that bacteria into the environment. So it'll reduce transmission, but it certainly doesn't prevent the disease outright. So, but it's a great way if we do have a lot of CL to help reduce transmission. So over generations, we will see much, much less. So hopefully it wouldn't be a vaccine that you would have to keep giving indefinitely. But it's a vaccine that you would want to start at a young age, because vaccinating animals that already have the disease, it's not going to make as much of an impact. So we'll start vaccinating animals usually after around weaning time. And then it's an annual vaccine. And because this vaccine is a little bit tough on them, we don't usually recommend doing it pre-breeding or during pregnancy. And usually it's a vaccine we'll give around weaning to does so that it doesn't cause a milk drop. Or if it does cause a milk drop, it's fine because we want does to be drying off anyway. So that is a vaccine that is mostly available. It is distributed by Colorado Serum Company, so sometimes they have shortages, but that is an option for helping to control this disease. Navel ill is another disease that we see quite often, usually within the first 2 weeks of life. It's a bacterial disease. Usually it's gram-negative bacteria that are in the environment and come up through their wet umbilicus. So that's where, again, our kidding environment is so important. And they can cause liver abscesses, it can cause umbilical abscesses, and then swollen joints as well. So a lot of times we'll see this especially in kids that did not get up and nurse the colostrum. We could have poor colostrum intake because the doe had 5 kids. So that's where colostrum management becomes really important. If we have a colostrum replacer available to help supplement that. And yeah, so it's a bacterial disease. So if we do start seeing this, then really important to get a good antibiotic protocol on board for these animals. For diarrhea for our young animals, if we're seeing it within the first 2 weeks of life, again, it's most likely failure of passive transfer related with environmental bacteria. So we could have E. coli and salmonella causing diarrhea at that point. Rotavirus and coronavirus are more common in barn environments, so we might see those. So if we have diarrhea that's not responsive to antibiotics, antibiotics don't really help us a lot with salmonella diarrhea, but might help a little bit with E. coli. But the most important thing with these guys is fluid rehydration therapy. We can also see diarrhea in kids that are being artificially raised. So if we're having mixing problems with the milk replacers, so these, they're babies, their guts are really sensitive, and we want to make sure that they're getting the same feed every single day. So making sure that, it's a good idea to weigh the powder, put in the right volume of water that's warm so it dissolves really well. And it should be really hot water so it dissolves really well, and then it can cool before we actually feed it. And then making sure that I think mixing errors are a lot of the reason for nutritional diarrhea. and then distinguishing that between other causes of diarrhea. And then other nutritional problems we can have is in babies, we'll see weakness related to selenium deficiency. And a lot of times that'll manifest differently. So we might have animals with selenium deficiency that actually died of pneumonia, and it's because they're aspirating the milk because they can't swallow really well. So these diseases aren't always super clear cut. So that's where having some diagnostics can help. Copper deficiency shows up a little bit later, so they're around 4 to 6 months old, and that's where they kind of start bunny hopping, and then they can't walk on their back legs. Unfortunately, it's a disease that we can't supplement to get them out of the problem, but it's an important thing to recognize so that when we have a next round of pregnant does, we make sure that they're getting minerals. And sometimes the minerals are there, but maybe they got wet, or for whatever reason, the does are not eating them like we were expecting them to. So crypto, this is a really crazy slide. So this is something that I had drawn for another presentation, but I kind of liked how it turned out. So with crypto, this is where managing our babies becomes really important. So we have kidding season, and if we're not managing that breeding to make that kidding season a little bit more evenly dispersed, we'll end up with a peak, and in that middle we'll have a lot of babies born. So we may get a little bit behind on our cleaning the barns, or we have kids that were born 2 to 3 weeks earlier are now, if they're being co-housed with these brand new kids, this parasite, it only takes about 10 days to, once a kid eats it, to replicate in the gut and then come out the back end to infect another kid. So if we have kids that are 2 weeks apart, those first kids could really be, already be shedding this parasite and exposing brand new kids to a huge infectious load. So the first kids do get it from adults, but because adults are pretty well immune to crypto, they're not really, shedding huge amounts in the environment. It's the new babies who pick it up, and it will amplify. But they, that's how they
We're
get.
getting better at that, aren't we?
So, I'm sorry. All right, I'm gonna keep going. Okay, so it is important for that kids are exposed to it, but to a small amount. If they are exposed to a large amount because they were living with a kid that's older than them, then they have a harder time dealing with that disease. We don't have a treatment for crypto for our goats, so it's really important to manage their environment. This is, so talking about coccidia, usually we see coccidia in kids that are 2 to 5 months old. Their highest risk is around weaning time. It's another parasite, and again, that's fecal oral transmission. And again, this is where if we can manage, a lot of times with coccidia, we're having to prevent it with nutrition and then coccidiostats in their diet. But this is where managing in different age cohorts can help with that a little bit. All right, we're getting on to parasites because I think there were some questions about deworming. So we do have in California and the West, most common parasites are these trichostrongyl type eggs. With a fecal float, you can't differentiate these 3 types of parasites. So there's the barber pole, which is the one that causes them to lose all their blood. There's the brown stomach worm and the bankrupt worm. Those 2 parasites will make them thin. You'll see edema under their jaw, which is protein loss, but they don't lose whole blood, so they don't go pale like this barber pole worm will make them. These parasites can infect sheep, goats, and alpacas and llamas and all that just as well. So the roundworm life cycle is a little bit longer. So if we start where the eggs come out, and they take about 4 to 10 days to develop from eggs into larvae. And these larvae can survive in the environment for a number of weeks. if they have low temperatures, it slows their development down so they can survive a little bit longer. If we have high temperatures, their development is sped up, and so then they actually are more sensitive to higher temperatures because they'll starve. So higher temperatures, especially if we have temperatures above 95 degrees, they are more likely to die. And then when they're in that L3 stage, they will wriggle their way up the grass, and they're found anywhere between ground level and about 3 inches up the plant. And so they're waiting there in little water droplets for goats to come by and eat them. Once the goats eat them, depending on what season it is, they may just kind of sit and wait in their stomach. But usually if it's a warm season like spring, they will develop into an adult in about 14 to 21 days, and that's when they will start shedding eggs. So this kind of auto-infection period is within, when they shed eggs, within 4 to 10 days, they can pick up an L3 larvae. So we typically say that 20% of the herd has about 80% of the parasites. And then 10% of those parasites are only in your animal, whereas 90% are in the environment. So that's where we have a lot of opportunity to manage parasites if we're doing fecal egg counts. We can tell, what our load is. Maybe we don't do everyone, but we could do everyone if we have a smaller herd size. If we have a really large herd, we might be doing a sampling to see what our parasite burden is during this time. And then we do know that we have quite a bit of parasite resistance. This research was done on the East Coast, where they do have a little bit higher parasite burden or pressure over there. But we know on the West Coast, we also have pretty high parasite or dewormer resistance. So they're not as susceptible to being treated anymore. For that reason, we want to make sure that we're only treating animals when they absolutely need to be treated. So one way to approach that is treating at high-risk periods. So maybe we'll treat all the goat kids when we're weaning because we know that they're really susceptible. It's a high-stress time. And so that's when, we've decided that we're going to deworm all our goat kids. But because we're not deworming all the adults, we're still maintaining some parasites in the environment that are, not exposed to the dewormer and potentially maintaining our ability to use the dewormers in the future. There's targeted selective therapy, which you've probably all heard about. This includes using FAMACHA or a 5-point check to identify animals that really need treatment. Working with a couple of herds that started working towards this type of treatment setup, there used to be times at weaning that they would just deworm everyone. Well, now deworming is not the default, and it's kind of, we'll be doing FAMACHA, and then all of a sudden we find an animal that's a little bit thin, has some diarrhea, and maybe is a little bit pale, like, oh gosh, where's the dewormer? We have to go find it now. So deworming isn't as much of a default in some of these herds because we've been able to kind of change that mindset around it. So 5-point check, I feel like, is a lot more useful for our operations because we don't have as much pressure with the homunculus or the barber pole worm. So, yes, doing FAMACHA is part of that, and it's important to identify animals that are infected with that. But we have other worms that are going to cause that bottle jaw or just loss of body condition or increased diarrhea. Combination dewormer therapy is something that is becoming a lot more well known. Unfortunately, in the US, we don't have combination dewormers that are available to us just outright. We usually have to decide to buy 2 different dewormers and then use them together. It's important to make sure if we do this that they're different drug classes. So that would be like an ivermectin class with a benzimidine, so like a Safeguard and Ivomec. Those are 2 different dewormer classes. And you can see how So we would consider a parasite susceptible if we get, this is the fecal egg count reduction. So if we start with 100 parasites per gram and then we end up with 20, that's an 80% reduction. Well, we would consider that resistant. If it's not a 95% reduction, then that deworm, we would consider that parasite population resistant to that dewormer. So you can see if you have these two drugs working in combination, you get a more effective treatment. And the same is true for some of these, we have, 60% reduction in all three classes, and we're able to achieve much closer to what we would consider susceptible. And so there's, evidence that using this technique can make our parasite population go back towards susceptibility, which is really exciting. The challenge with this is if we're not using it in a selected manner, then we're exposing all the parasites to all the drugs, and we can develop multi-drug resistance in our parasite population, which would be not good. Copper oxide wire particles are really exciting for goats, especially because they do have a higher copper requirement than, say, sheep do. Copper oxide wire particles only work for barber pole, though. That's great. Well, I'll take it, especially when we're using them. If we have herds that are running both sheep and goats together, this is a way to get copper into our goats when we can't use a free mineral that has copper. So this is something that can be done once a year. If we're in a really copper deficient area, maybe twice a year. But I would use it strategically. So we're targeting those parasite populations more during that springtime. Condensed tannins are basically in a lot of, it's a secondary compound that's present in a lot of plant species. Sericea lespedisa is the one that we have most research on. It's present in the South, but bird's foot trefoil, chicory, we have a lot of those on the West Coast. And these are really great at killing parasites, not just roundworms, but also coccidia. The challenge is, depending, if we get too high a percentage of condensed tannins, what do we know about tannins is that they actually decrease the amount of protein that the animal can absorb. So, it can be a little bit challenging. We want to make sure that it's not too much of a percentage of the diet, but it can be used, maybe in high risk periods to help modify the diet so that we're helping manage our parasite burden. The BioWorma is a new product that has come out in the last couple years. It is a fungus that's actually put into a feed supplement, and it passes through the goat's digestive tract. So it's a spore. It's really important that if you do use BioWorma that you don't get it wet when it's in that powder form, because then the spore will basically develop and then it can't survive the gastrointestinal tract. So it needs to stay as a spore, and then it goes through the gastrointestinal tract and comes out in the manure where those eggs are also. And so it works in that kind of fecal pellet and helps kill the larvae as they develop. I kind of love this picture. You can see the fungal creates these little lassos and traps the larvae, and then it just kind of takes all the nutrients out of the larvae and kills them. So it really helps with decreasing pasture contamination. It sounds like it's quite expensive. I haven't met anyone over here that has used it yet, but there's, maybe a way to do this in a targeted manner. So when are we most worried about pasture contamination? If we have new animals coming in, maybe we want to just target it with them because maybe they're bringing in parasites that, we're not sure if they're resistant to dewormers or not. So potentially some exciting. Arkansas is doing some research on using those in a selective manner. Pasture management with pasture rotation can be a really helpful tool. I would say with pasture rotation is also managing how much grazing they're doing. So if we only graze down to if we leave a residual of 4 inches, the chances of them actually being exposed to those parasites is really slim. So, making sure we leave a little bit of a residual and then rotating, every 4 to 7 days, depending on the temperature. And that was that auto-infection period of when eggs are deposited, when they become infective to our goats. Pasture rest is something that I have a challenge with. So pasture rest in warmer months, it's smaller. So if we're able to rest pastures for 2 to 3 months when it's really hot, then the contamination that pasture goes way down because those parasites die that have been deposited. In the winter months, they overwinter really well. So resting a pasture for 6 months is kind of silly because by the end of 6 months, it's summer. So it's I have a hard time with pasture rest, but I think we can manage it with, keeping an eye on how much residual dry matter we leave. With herd improvement, there's a couple ways that we can think about this. We can have host resilience. So that's the ability of the goat to, be infected, but also not succumb to disease, if that makes sense. So they have parasites, but they don't lose weight. They don't decrease production, anything like that. But they will still shed eggs. So they will still contaminate pastures. Host resistance is where they're actually able to kill parasites. So their immune system is able to respond. Fortunately, resistance is more heritable than resilience. So we can select for that. And the best way to select for that, and you've probably seen some of these, is with fecal egg count estimated transmissibility or estimated breeding values. And so we can do that by, there's different tests that people will do, but basically, in a controlled way, we're doing fecal egg counts at weaning or after weaning. And then, it's after a certain known exposure. And then based on that fecal egg count, if they have a lot of eggs present, then their score is not going to be so great. If they have no eggs present, then they're going to have a better estimated breeding value for parasite resistance. Treatment records and FAMACHA can be another way to select for animals that don't need as many treatments or don't succumb to disease. But we can by selecting with those tools, we might not necessarily be selecting for resistance. We may also be selecting for resilience, which might be okay. But knowing that if we have resilient animals in the herd, that they're still able to contaminate the pastures. So fecal egg count, estimated transmissibilities is where we might want to focus for our breeding programs. So that's what I have. I know there's a lot there, and there's even more that we could talk about, but I know we're certainly over time. I was told we could go a little over. So if there are questions, I'm happy to try to answer them.
Perfect. Thank you, Rose. We did have a couple questions. So back up in the body scoring, Heidi asked, can you provide the name for the information, I assume for body score? Heidi, correct me if I'm wrong. We've had a couple of goats that I'd like to do a better weight assessment on.
Yeah, so it was usually I have a QR code on that slide, so I don't know where that went, but sorry. So there's a video that the American Dairy Goat Association produced with Langston University. Langston University is going through a lot of changes, so it's hard to find some of these resources on their websites currently. But if you look under the YouTube search for Langston University Goat Body Condition Score, they're on YouTube, so you should be able to find them there.
Thank you. Katie had a question. At what age can I take the kids off the dough?
So for weaning, any time. No. So it just depends. The famous extension answer, right? It depends. So if we are prepared to raise the kids on milk, then we're taking them off the dough immediately. Some folks will leave them on the dough for a little bit, like a week or so. I don't know the benefits of that type of kid rearing system. Would love to learn more if people are doing that. But otherwise, if we are using the does to raise the kids and we're just wondering when we can wean them, they can be weaned. Probably most commonly, they're weaned around 60 to 90 days. 60 would be considered early weaning. So, we'd want to make sure that if we are weaning them early, even when we wean at 90 days, if we were weaning at 60 days, we want to make sure they've had access to some kind of grain and forage to help develop their rumen. By the time we wean them at 90 or 120 days, their rumen's pretty well developed. So that transition isn't as hard for them. It's one where if we do that early weaning, they can do it. They just need to have some access to that forage and the grain to help that rumen develop a little bit faster than it would normally.
Thank you. Heidi also asked, where can you get a FAMACHA card?
FAMACHA cards they can be given by trainers. So like I can give FAMACHA cards if we do like a FAMACHA training. One of the things that they require is that you know how to do it's called push, what is it, like push, roll, and pop or something. It's basically the technique to looking at the lower eyelid. And they're allowing us to confirm that with a video. So if you're able to take a video of that and, send it to Rose, and then, I don't know if you guys give FAMACHA cards up there, but yeah, either you can get them through, some folks in Extension have them, but basically I order a bunch of them, and then when I do FAMACHA workshops, that's how we get them out. But there's laminated cards that are printed so that the color is like exactly on what you would expect for that.
Lynette Leggett asked, how often do you see polio in kids?
Polio, we can see that especially if they're on high grain diets, I'll see polio quite a bit. So polio will happen anytime they have some kind of upset to their stomach. So if we, high grain can do that, we can have that if they're off feed for any other reason. So I'll see it in adults if they're sick for another reason and they're not eating, then they'll also get polio. So polio is pretty common. Having thiamine on hand is just a good idea, because if you see any neurologic animal, that's like the first, because you can reverse it if you're able to get thiamine into them early enough.
Another question was, can you discuss free martin in goats? How often does it happen to buckling doeing twins?
It is more common than I think we talk about. So free martins are where the buckling is, or does are, you have mixed litters of does and bucklings, and they're when the does develop, they look more like a buck. And so, they'll have a big poll and a beard and a really abnormal looking reproductive tract. And it can go both ways. So the bucks can look more feminine. So we actually have a case right now at our goat barn on campus that we have a pair of free martins. So it's quite common. So it's something that I would just be aware of, because mixed litters are also pretty common. So just as they develop, if you have females that have a large clitoris and have all those kind of other buck characteristics, that's very likely what has happened.
Also, what minimum scrotal measurement should be used when selecting herd sires?
Oh gosh. I know that they recently changed that for goats. I don't know that they even had that established for goats before. I don't know it off the top of my head, but I can look.
And I can provide your email on the recording link as well.
That would be
so then whoever asked that question, reach out to Dr. Rosie and she can help you with that.
Yeah. Yeah, that would be good.
Christine asked, if you're bottle raising kids, at what age would you introduce grain?
Within the first week. They won't eat a lot of it, so you don't have to put a ton of it out, but it's good for them, especially because there's not usually an adult to go around to kind of teach them what is edible. It's good for them to have exposure to it early on, and then they will learn that they really like it and they'll eat a lot more of it, so that by the time they're ready to wean, they should be eating quite a bit, half a pound to a pound a day. So the earlier we can introduce it, the more likely we'll get to that level and we'll feel comfortable weaning them.
And Kayla, I see your hand raised, but I have a question in the chat from you, so I hope this is your question. She asked, what is the rate at which health kids should be gaining weight per month? I did read that a Nubian kid should gain 10 pounds per month. Is this accurate? And do you know any research on this?
It is definitely going to be breed dependent. And again, I don't know that off the top of my head, but you can certainly email me this, because I have been looking into this for other operations that have different breeds. But it's a good thing to have, kind of in the back of our mind. So yeah, that would be a good one to follow up on as well.
Amanda was asking if you have any online ultrasound trainings.
I don't have any online ultrasound trainings, but I have been working with a lot of vets around here to try to improve their accuracy and get that going for them as well. But I have found some, but most of them are from Britain. And there's some goat specific ones. And so if you're interested in those types of training, there are probably some trainings that you can get, but I doubt they're local kind of a thing. Sorry.
And Dave Brink, who's one of my colleagues in Montana, said most FAMACHA certification is conducted live because of the technique, but there are some online trainings available. And he included that link in the chat. So if you're interested, please look at that. Kayla also asked, best deworming combo of meds for barber pole worms.
So it's good to know. That's where doing that fecal egg count reduction test can be helpful. So you kind of know what, if we have resistance or not. The challenge with that is only testing one drug at a time. So the best combo is just going to depend on, what your parasites are likely kind of resistant to. What a lot of folks are doing is, like using levamisole with like a ivermectin type of dewormer. So those two work pretty well. The challenge with levamisole is it has a little bit lower margin of safety. So just making sure that we're not, that we're pretty accurate with our weights and giving them that way.
Josie is asking, what is a good homemade herbal way of deworming? She's looking in to grow her own herbs and dry them to give them to the goats.
So there's a lot of research on kind of herbal or different types of deworming that are plant-based. Most of them, I think the only ones that are really have shown to be promising are the Cerisa lespedisa, and then pumpkin has the pumpkin seeds. There's something to that. The challenge with the pumpkin seed is getting them to eat enough. And, as soon as we start kind of overwhelming their diet with one specific type of plant product, we may be shifting their diet away from a kind of, we're not able to meet their needs as much. We're not getting the right energy and protein and fiber into them if we're focused solely on these kind of different sort of plant-based remedies for deworming. So I haven't seen a lot of, great evidence out there for a lot of the kind of herbal types of deworming.
Let's see here. Kayla also says she has 3 goats with low magnesium levels in lab work, 2 lactating and 1 is a pet. Do you have any advice on how to increase those magnesium levels?
Well, I would, if they have access to like a free choice mineral, there's usually magnesium in all of those minerals. So other than that, I'm not sure of a specific supplement just for magnesium.
And the last question we have is Danielle says, we pasture kids in a large group of meat goats and seem to have trouble with navel ill only after rainy days. Trying not to disturb the kidding bed, so don't dip navels normally, but may need to dip navels on those days. Does that sound right?
Yeah, I think that makes so that one picture of the liver that I showed was a pasture situation, and it was just a really wet year where they had never seen that before. And so I think you're right. When we have really wet, kind of mucky times during our kidding season, is when we need to focus on those animals that are born during those times. But yeah, typically in a pasture situation, we don't need to because they're up and they're moving a bit more. But yeah, when it's really mucky, it's important to help dry that umbilicus out. And that's where, the iodine solutions are really helpful for those because they'll dry that umbilicus up pretty quickly.
And Dave Brink mentioned in the comments too that Montana is trying to do some FAMACHA trainings this year. So just keep an eye out, ask your local extension agent if you're interested in those, or reach out to Goat Montana as well. There's a lot of thank yous on the chat, and what a wonderful presentation this is. And we want to thank Brett Rader for this. Brett is actually on right now too. He's the one who got Dr. Rosie to do this for us.
Thanks.
And we're so thankful for him, and we're so thankful for Dr. Rosie for spending her time with us tonight. I'll give you one more minute if you guys want to put anything in the chat for questions. If not, I will send the recorded link with an evaluation plus Dr. Rosie's email address. So if you want to reach out to her directly, please do so.
Yeah.
Is there anything else in closing that I should include?
I don't know. I think there's so much to know, and just taking the opportunity to learn from everything that happens, I think is the best thing that we can do with our, for our animals. Is every year is a new year. You're going to see things come up that you never expected. So, kind of taking them in stride, learning from those opportunities. If you have a veterinarian around, yeah, complete records. But yeah, working, to make sure that we're learning from every opportunity that we have.
And Kayla had one more question. She says, rose hips, fennel seeds, raspberry leaves given to pregnant does. Any thoughts on that?
I'm not, sorry, I don't know what, what I would use those for. So sorry.
It sounds like a good marinade.
Yeah, it sounds like a great tea. I don't know.
Yeah.
Sorry. No, I don't mean to joke because I do think there's definitely some merit to secondary plant compounds and impacts. So, but I just am not super familiar with those. So.
Are those, Kayla, are those like to put in their diet or for browsing? Like if they're out on the pasture grazing rose hips and maybe your fennel in your garden after you're done? Oh, she gives in feed 1 month before pregnancy. Huh.
Yeah.
That's pretty interesting. Do you know of any research, Kayla, that comes out of, or is that just something that you've naturally done?
So no, I just actually read about it, and I saw on a couple of Nubian breeders were actually feeding this mixed with corn, a little bit of corn and barley as well as oats, given just a little bit along with cinnamon to the pregnant does. It's supposed to help like prepare their bodies for pregnancy and their uterus for contractions and just makes everything easier. So I'm like testing it out. I have does that will kid in 2 weeks, and it's 2 of them that I'm feeding it to, so I'll let you know.
That's awesome. Crystal, who started this by kidding out her doe, just had triplets. So congratulations, Crystal. That's awesome. She says, great information tonight and great job on answering questions. And Corianne had a question. What causes late-term abortion and how can it be prevented?
So there's most common cause of late-term abortion is chlamydia. Campylobacter can also, but in goats, most commonly it's chlamydia. It's a bacteria, but it can be other things as well. So there's other bacteria, there's other parasites and things that can cause abortions. So if you are having abortions in goats, and it's more than just one here or there, it's probably a good idea to try to take those to a lab to get them diagnosed. And if we want to take the fetus, the placenta, and then if possible, some blood from the doe. And that can get us the best chance of figuring out what was going on. For chlamydia, the best way to prevent it is with a vaccine. So antibiotics, because that infection happens kind of around mid-pregnancy and they don't lose it till late pregnancy, giving antibiotics at that point to the other does is not really going to prevent having more abortions. So it's, once we have it, good idea to try to prevent it in the future with vaccines.
Awesome. Well, it is 8:30 Montana time, 7:30 your area. I just want to say thank you to everybody. Amanda just popped one more question in though. She says, I know raspberry leaves are supposed to help with strengthening the uterine muscle in both goats as well as humans. And Josie said, Corianne, be careful to notice that if does are squeezing through tight areas often or being attacked by other does often, it's a common way for abortions to happen as well.
Yeah, there's definitely a lot of different causes for abortions in goats. They're more prone to just any kind of change like stress. So yeah.
Awesome. Well, we'll stop there. Thank you so much, everyone, for coming. I will send the recorded link and an evaluation out, as well as Dr. Rosie's email address. So have a wonderful evening. Please remember, Dairy Goats will be up on March 7th with Kelly Katani. She's another extension agent based out of Butte, America. So good night. We'll see you guys later.
See you.